So this lecture is going to look at some of the treatment modalities for eye infections and for dry eye. And if you notice here on the cover slide, I have a picture of peacock feathers because those feathers look like eyes. I have very few eye images in these presentations because I think eyes are disgusting. I'm sorry if that offends you, but it's the honest to God truth. And so I really try to avoid anything eye related because they are just so creepy to me. So we'll spend a little bit of time on bacterial conjunctivitis, aka pink eye, and there's several antibacterial agents that are available, and we've gone through most of these. Understand that conjunctivitis is usually diagnosed as a red eye or a pink eye in patients, and literally it means inflammation of the conjunctiva. Okay, and so we're looking at inflammation of the mucous membrane that lines the inside surface of the lids, and it's due to a wide variety of bacteria that Dr. Richards mentioned in her lecture: Staph aureus, strep pneumonia, Haemophilus influenza, and a few others. Okay, and so patients that have bacterial conjunctivitis typically complain of redness and discharge in the eye. Okay, antibacterial agents are really important to treat this. In many instances, it can go away and become self-limiting, but the problem is that it's very catchy. And so if any of you who have kids or younger siblings know that once somebody gets it in the house, everybody gets it. And so we had this this outbreak in our house just this past winter where the entire family got pink eye because my son's kindergarten class had an outbreak. And the worst person to install eye drops in was not the kids or my parents or anyone else. It was me. And so it took my family, my wife, and my children to hold me down so that my wife could put eye drops in my eye. So my disdain for eye continues. And so this is a nice segue into viral conjunctivitis, and certain viruses can obviously cause conjunctivitis. The most common is the adenovirus, which is the non-bacterial version of pink eye, but some of these other viruses that are listed here can also cause a conjunctivitis and need to be appropriately treated. You can see it typically present as a watery or mucousy kind of discharge. The only difference is there's like a burning or a sandy or gritty kind of feeling in one eye. There's no specific antiviral agent for the treatment of viral conjunctivitis. Antihistamines or decongestants may help with some of the eye irritation, but if the infection is caused by any of these herpes or CMV type infections, then the appropriate treatment is listed. Allergic conjunctivitis is often caused by airborne allergens that have contact with the eye and through an IgE type of response cause a local mast cell degranulation and the release of chemical mediators that are pro-inflammatory. It typically presents with redness, watery discharge, and itching. Either of these drug combinations can be used to treat the symptoms of allergic conjunctivitis. Dry eye is kind of a catch-all bucket or multifactorial disease of the tears in the ocular surface that really kind of results in ocular discomfort and can go all the way to visual impairment. Dry eye is also known as ketoconjunctivitis, CISIA, or dry eye syndrome, or dysfunctional tear syndrome. Lots of treatments for dry eye exist basically at aiming or increasing supplementing the tear production, slowing the evaporation of tears, reducing tear resorption, and reducing ocular surface inflammation. First-line therapy for these patients complaining of dry eye is tear supplementation. Artificial tears generally have a cellulose or polyethylene glycol component to them to maintain viscosity. And you can also see polyvinyl alcohols which prevent evaporation, and some electrolytes to make it basically hypertonic. Topical eye drop solution include lifitegrast, which is basically a 5% integrin antagonist, which was relatively recently approved by the FDA back in 2016 for the treatment of dry eyes in patients that have it. Low-dose glucocorticoid eye drops can also help relieve the symptoms of dry eye and have traditionally been used for that purpose. Dr. Richards had talked about a few parasites that can invade the eye. One of those drug classes include albendazole, which is a benzimidazole type of compound. I don't want to get into all the parasitic drugs. I'm going to save that for next year. But I will briefly kind of go over the mechanism of action just in case you're interested. It has 4 known drug mechanisms of action, one of which targets the beta tubulin, the second of which alters the metabolic activity, something around glucose metabolism. The third mechanism interferes with the cells, the parasitic cells' ability to move, and the fourth one also is a metabolic component that centers around ATP. Okay, so I don't want to get into all the anti-parasitic bugs. I think you have enough on your plate. But you know, from a step standpoint, all of these tables are coming from the step prep guide. Because we're covering them here in this particular time and place, this is why they appeared here. But I don't want to test you on it at this point. You will be tested on the anti-parasites later in the curriculum. Another anti-parasitic drug that you should be familiar with is ivermectin. And this actually kind of fits into the neuroblock because it's centered around glutamate channels, which are chloride channels. And we'll talk a lot more about the glutamate receptors in the next upcoming cases. And so it's just another drug that can specifically treat some of the parasites that have been known to cause eye infections. There are some fungi that can cause, There are some fungi that can cause eye infections, although they're really rare, but you know, it can occur, and you can see infections in the cornea. Most common way to develop a fungal infection is typically the result of eye injury. Symptoms usually include pain, redness, blurred vision, sensitivity to light, and excessive tearing and eye discharge. The main antifungals that are approved for eye treatment are listed here. Natamycin is probably the only formulation of that compound for eyes. And then we've talked about the imidazoles, ketoconazole, and so forth in several other venues and so forth. These medications can also be given systemically. They can be injected directly into the eye, and they can also be injected into the bloodstream through a peripheral vein. Okay, so that's pretty much it for some of these eye infections. I just wanted to basically you to know that there are formulations that exist where a lot of these systemic antibiotics and antivirals and antifungals can be given topically. And so as you kind of review this step prep material later on in the curriculum, you can kind of come back to this. But I think as long as you know how those drugs work, you're pretty much set, and I don't need to retest you on them. Okay, so thank you, and enjoy the rest of the block.